Welcome to the By Design radio program. My name is Dr. James Proodian of Proodian Healthcare and ProodianHealthcare.com, where health literacy is the key to longevity. And as long as God has us on this side of eternity, my show is designed to help educate you and your families to feel better, function better, and live as many quality disease-free years as possible. Thanks for joining me this week as we continue our multi-part series on pain, and this is show number 7 on pain, and this is part 2 of autoimmune disease. We're talking about how autoimmune disease is a major producer of pain, and for those of you who have had an autoimmune disease, you understand what it is I'm talking about. And last week's show, we covered what is autoimmune disease. We defined it. We talked about the human body basically turning on itself by using a series of cells that basically attack its own immune system. And we also then covered, out of the 80 or so named autoimmune diseases, I rattled off about 12 or 15 of them that are the most common, the ones that you see the most in clinical practice, or maybe the most that you guys have heard of out there, and the fact that they do have a lot of similar characteristics like fatigue, low-grade fever, some joint pain, generally not feeling well. And as we went through the subject matter and we really took it apart from a literal scientific perspective, we did isolate that there are 4 groups of people that tend to have a higher percentage of prevalence in getting an autoimmune disease. Category 1 were women of childbearing age. 2 were people with a family history, that there is a genetic or an epigenetic component. 3, the people who are around certain things in their environment, such as chemical exposure, viral and bacterial infections are also linked to autoimmune disease. And then finally, our 4th category were people of certain races and ethnic backgrounds. And I shared with you that disease processes are more prevalent in certain groups of people. That's just the way it is. I talked about how lupus in the African American and Hispanic communities has a higher prevalence rate than in the Caucasian community. So autoimmune has similar characteristics. With autoimmune, sometimes diagnosing them can be challenging. Many times it requires many trips to not only one doctor, but 2 or 3 different types of doctors. And where we left off in last week's show was that if you're thinking you might have an autoimmune, before you go to your doctor, remember, you want to write down symptoms that you might have. You want to write down your family history. Doctors like to read bullet points. We don't like to read reams and reams of information that you print off of web.com. But I find it to be very important that when a person writes down the medications that they're taking, the symptoms that they've been having, and in a simple 1 page, it really does help a doctor as you walk in and meet him or her and you're doing your consult. It keeps the information very organized, because with an autoimmune disease, you have to pick through the best or the most appropriate avenue of approach. So let's say, for instance, patient comes in and they have a certain set of symptoms. Most likely, you're going to be referred to a specialist. Now, that specialist could be a kidney doctor or a rheumatologist or an endocrinologist, for instance. Maybe you're going to go to a neurologist or a hematologist or a gastroenterologist, dermatologist. So the specialists out there are equipped to take conditions out of the GP's hands many times and isolate them down to render a diagnosis. And like I shared with you last show, doctors' jobs are to give you a diagnosis, basically answering the question of what is wrong with me. And then number 2, to then deliver treatment options. So first, right now we're in the what is wrong with me conversation. All right. So as you look through this article that I took off of womenshealth.gov, which is from the United States Department of Health and Human Services, we're on page 10 or so of a 12-page document. And what's really interesting, of all of the specialists, and this is where I'm going to start disagreeing with this document, how medicine thinks. They rattle off about a dozen or so specialists that now an individual is going to go see. Not one of the specialists do anything with relation to nutritional counseling, stress management, or altering your physical fitness program. So we have to be very careful here. Autoimmune diseases many times are triggered off by lifestyle, the poor diet, the increased amount of stress that's in someone's life, and lack of exercise or too much exercise. So as we get the diagnosis, the treatment options typically are just medicine. And that's where I draw the line, meaning that there is a place where we render the diagnosis, and yes, there's medication that's prescribed, but that's not where we stop at all. Definitely followers of this show, I hear you guys when I see you. You have your health journals, you're learning, you're becoming more knowledgeable on the prevention of chronic illness. Well, if we're really going to prevent chronic illness and we're going to do something about it when we get it, we better be equipped with God's plan and understanding that there is a physical and nutritional and psychological component to everything that ails us. So let's continue. And remember, the Bible verse of the show is Luke 1:37, for with God nothing is impossible. So we have to have that approach as we learn and we gain momentum with our passion towards taking better care of ourselves. So now when we talk about having the diagnosis, now we're up to the part, what do you do for me? What do I do, doctor? Okay, thank you for the diagnosis. Right, I didn't realize I had this condition. It's an autoimmune condition. What do I do? So obviously, guys, there's a pill for every ill. There is a medicine for every autoimmune disease. There is a medical approach, and I'm not disagreeing with it. I'm not saying that the medicines that are available for autoimmune aren't good and that you should not take them. Follow your doctor's advice, but here's what we're going to do today. There are many types of medicines used to treat autoimmune disease. The type of medicine you need depends obviously on the disease you have, how severe it is, and what your symptoms are. So there are plenty of autoimmune diseases, like we talked about last time, that go into remission, okay, which means they've gone away. Then sometimes they come back, and they come back in a fury. So our medicines are basically designed to do what? Well, of course, relieve symptoms. Medicines are designed to put the body in a state of less pain, okay? Less pain, less swelling, less depression, less anxiety, maybe helping us with our sleep or our fatigue, okay? So there are medicines, obviously, for autoimmune that do that. They also, remember, medicines also have, even though they make you feel better and relieve the pain, they also suppress the immune system. Now, when we have an autoimmune disease, we realize that we're already immunosuppressed. So this is why medicine, when it's used, is making the patient feel better, all right, relieving the symptoms. But we have to be careful with medicines because many of the medicines also suppress the immune system. And we don't want to suppress the immune system too long when we have an autoimmune disease. So this is where it becomes a little complicated. At this point, what I tell my patients, or when I meet a patient, when you get the diagnosis and you're on a medicine, that's when you want to go to a functional medicine practitioner. And you've heard me speak about functional medicine. And if you're looking for a functional medicine practitioner, you look one up online, okay? Go to functionalmedicine.org. You could put in your zip code and you could find a practitioner, because this is the type of a person that's going to be looking at you not just from a medication perspective. They're going to be looking at toxification, digestion. They're going to be looking at immune function. They're going to be looking at inflammation and how inflammation, or your diet, the types of foods that you're eating. They're going to be looking at your stress levels, fatigue. So a functional medicine doctor is going to tie together many pieces, not just, oh, you have an ill, I'm going to give you a pill. Again, there's not a place for that. Okay, so this is the point we want to do that, because now as I get to the last page of this article, the first, 11 of a 12-page document are all dead on. This is exactly what the condition is. These are the conditions. These are the medication treatment options. Now, on the last page, half of the page, this is the kind of stuff that gets Dr. Proodian upset. This should be on the first page. Let me read to you the title. What are some things I could do to feel better? On the last page, what are some things I could do to feel better? This is now like their throwaway information. You know, you're writing an article, the very last page, you know what I'll do if I was the author? I'm like, well, I'll give them the really important stuff first. And on the last page, let me just throw in there, you know, what are some things I could do to feel better? And let me read to you. There's 4 bullet points. And for those of you listening to my shows now for like 70 weeks, I think you'll understand why this gets me a little bit frustrated. The first one is eat healthy, well-balanced meals. The second one is get regular physical activity, but be careful not to overdo it. The third one is get enough rest, and the fourth one is reduce stress. So this is my problem with healthcare today. We go to the docs, we have these very complex conditions that are multidimensional, from our diet to our stress levels to our lifestyle to the lack of exercise or too much exercise. And you women out there, the too much exercise thing is a major component to triggering off autoimmune disease, because too much exercise is a stressor to your body and it allows the autoimmune disease light switch to go on. But anyway, here we are. And at the very end of the day, make believe you're in the doctor's office and they've diagnosed you, they've written you your prescription, they've told you how to take the prescription. Oh, and by the way, what do they always tend to end the conversation with? Oh, Mrs. Jones, you need to eat right, exercise, make sure you get enough sleep, and avoid stress. Have a nice day. What does eat right? What does exercise mean? To who? To what group of people? What type of dietary protocol is appropriate? Let's say I have Crohn's disease, or I have rheumatoid arthritis, or I have Hashimoto's disease, which is the thyroid condition. What specific types of foods did God create that are medicinal that could help heal my body? That's the question we need to be asking. Now, the problem is most medical doctors are great at the diagnosis process and writing prescriptions. But when it comes to spending an hour with a patient, ripping apart their dietary plan, looking at blood chemistry, doing biometric measurements, and writing out a very specific eating program to allow, let's say, their gut to heal, that's not going to happen out there with your medical doctors. Getting proper physical exercise. I happen to be a certified strength and conditioning specialist, and I happen to be a sports chiropractor. I went to school for this stuff. There is a very specific place for exercise. Many times with autoimmune, there is no exercise. You need the body to heal. You need to allow the immune system to heal. So it depends upon the state and the condition of the autoimmune disease, which will depend upon the specific dietary protocol and the specific exercise program that the patient is under. Get enough rest. What does that mean? What time of the day should I be going to bed? Should I be taking an afternoon nap to allow my metabolic rate to readjust and to heal in the afternoon? All right, this is critically important. Do I have sleep apnea? Because if I have sleep apnea, you're not getting enough rest because your brain never enters REM sleep when you have sleep apnea. And REM sleep is when your body is truly healing. So you're constantly in this fight or flight reaction, which is the last point, which is to reduce stress. If you want to learn about stress, please go back to my earlier shows because we took stress apart. So now let's conclude. We now have identified, we're going to wrap up this second show. You guys understand now what autoimmune disease is. There are 80 types of them. They're all inflammatory. They all produce fatigue. We feel lousy. Many times people have severe gastrointestinal problems with autoimmune, severe joint pain and rashes and inflammation around the joints. These are serious conditions, guys. These are not, I injured my pinky toe. These are severe things that the human body is under attack. And yes, medicine has its place, but let's underline the word but in our health journals. We have to then take the ball, take the personal responsibility, understand that many of the medical doctors, they've done their job. They diagnosed it. They wrote you a prescription. They're going to monitor you. They're going to take their x-ray and their bone scan and their MRI. I do the same thing in clinical practice. I want to monitor the condition. I want to see if it's progressing. I want to make sure the bloods are being done and the radiology is being done. But let's go back to that word, BUT. We have to have prescribed anti-inflammatory, most of the time dairy-free, gluten-free protocols when dealing with autoimmune conditions. And it's not as specific as that. I don't want you to just start eating dairy-free, gluten-free because Proodian said so. These need to be better isolated. We have to look at food as medicinal, and if we think we have an autoimmune disease or we have one, we have to attack it straight up. We have to be very proactive to get it into the state of remission. Getting physical exercise and the type of exercise you should have all depends upon a solid physical exam to see where you are in the state of your autoimmune condition. And again, with the stress, the fight or flight, we need to get out of the fight or flight response, and we need to re-stabilize the stress hormones in your body. So hopefully you learned something over the last couple of weeks on autoimmune. Very complicated subject matter, but my job is to take complicated subject matter and make it user-friendly. And hopefully these shows are allowing you a better source of information, better insight to the way the human body works. And as we pray for our children and we pray for their health, remember, it's not just the fact that we have prayer. We have to take the ball that God has given us through the design that He has given us and use the knowledge that He has given us to apply physical, nutritional, and psychological changes to our lives. Thank you for listening to the By Design radio program and me, Dr. James Proodian. If you want more information about me, please go to ProodianHealthcare.com. Submit any questions you might have. Have a blessed week and be well.